Hi sir, my name is Azrael Maluna, taking of Bachelor of Science in Agribusiness Management. So for today's video, I would like to explain the animal products borne disease. So the borne disease is that food producing animals are the major reservoir for many foodborne pathogens such as Campylobacter species, non-type secrotypes of Salmonella enterica, and Shiga toxin reproducing strains of Escherichia coli and Listeria monocytogenes. So the disease associated with meat, there are several diseases well known to both the industries and the general public that are directly related to the domestic meat species of beef, pork, lamb, and poultry. So, in addition, the meat on food industries are vulnerable to a variety of other infections, disease that can manifest in food processing areas due mainly to poor personal hygiene and processing sanitation practice, which in turn can develop the growth of bacteria, viruses, molds, and yeast. So this can set the stage for foodborne infections such as Salmonella or trichinosis. So caused by ingesting food that are contaminated with bacteria, parasite, and viruses. So the foodborne um, intoxications, either bacterial such as E. coli or chemical where food has been contaminated with toxic chemicals such as cleaning compounds or pesticides. So the two particular dangerous foodborne bacteria that can cause serious illness required especially the Clostridium botulinum, so which is can develop in vacuum packaged and canned foods. So the botulinum toxins are ingested through improper processed food in which bacteria or the spores survive and then grow the produce toxins through mainly of foodborne intoxications. So human metabolism can also be caused by intestinal infection with botulinum in infants, food infection, and by inhalation. So the symptoms of foodborne metabolism. So the botulinum toxins are neurotic, uh, neurotoxic, and therefore affect the nervous system. So foodborne botulisms of character is characterized by descending flaccid paralysis that can cause respiratory failure. So early symptoms include marked fetang the fatigue, weakness, and vertigo, usually followed by blurred visions, dry mouth, and difficulty in swallowing and speaking. So the disease can progress to weakness in the neck and arms, after which our respiratory muscles and muscles of the lower body are affected. There is no fever and no loss of consciousness. So the symptoms also are not caused by the bacterium itself, but by the toxins produced by the bacterium. The symptoms usually appear within 12 to 36 hours. So within a minimum of maximum range of 4 hours to 8 days. So after exposure. So incidence of botulism is low, but the mortality rate is high. Prompt diagnosis and appropriate um, immediate treatment, early administrations of antitoxin and intensive respiratory care. So that is the botulinum disease. So the next foodborne disease is Listeria monocytogenes. So this disease, um, which occurs due to poor cleaning or machines' dirty floors and drains. So listeriosis is a serious infection caused by the germs Listeria monocytogenes. So people usually become ill with listeriosis after eating contaminated food. The disease primarily affects pregnant women, newborns, or older adults, and people with weak immune system. So it's rare to people for people in other groups to get sick with Listeria infection. So listeriosis is usually mid illness for pregnant women, but it causes serves disease in the fetus or newborn baby. So some people with Listeria infection, most commonly adult and 65 years, and older, and older than and people with weak immune system to develop served infection of bloodstream causing sepsis or brain causing meningitis or encephalitis. So la Listeria infection can sometimes affect and other parts of the body. So that is the effects of um, Listeria monocytogenes. So the next disease, the in foodborne is Clostridium perfringens. So an aerobic microorganism grows without air. Can occur, and this disease can occur and improperly prepared meats that have been left to stand for long period of time. So this disease, which is the Clostridium perfringens, can be found on raw meat and poultry. So in the intestines of animals and environment. So this bacteria makes spore which act like protective coatings that helps bacteria survive under certain conditions such as when food kept at unsafe temperature. So common source of um, this disease infection, which is the fringes, is include meat, poultry, grapes, and other foods cooked in large batches. Outbreaks tend to happen in place that serve large group of people. So such as hospitals, schools, uh, cafeterias, prisons, and nursing homes and events with catered food. So this disease outbreaks occurs most often November and December. Many of these outbreaks have been linked to food commonly served during the holidays. So that is the effects of those foodborne disease. So the next foodborne disease is salmonella. So salmonella, this infection is caused by salmonella bacteria. So the bacteria are passed from face of people or animals to other people, so or other people. So contaminated food are often animals in origin. They include beef, poultry, seafoods, milk, or eggs. So, but all foods include some unwashed fruit and vegetable can become contaminated. So, Salmonella typhi is one of the type Salmonella that lives only humans are passed on the from human to human through contaminated food or water. It tends cause serious and life threatening. So infection called typhoid fever. So the treatment of often needs antibiotics. Um, small number of people uh, who are treated by feed better after treatment. So but they will continue to carry the organism and pass it through their feces to other through contaminated food or water. So the risk of for salmonella infections is anyone can get a salmonella infection, but the young children, older adults, and people with certain health conditions such as HIV, cell disease, cancer, or organ transplant is a greater risk for coming down with the disease exposed to the germs. So that is the infections of salmonella disease in foodborne in the food product of animals. So the next foodborne disease in an animal product is Staphylococcus aureus. So this disease it is the leading cause of skin and soft tissues infections such as abscesses. So um, although most staph infection are the not serious, as aureus can cause serious infection such as bloodstream infection and pneumonia or bone and joint infections. So the symptoms and the signs of these infections is most infection caused by aureus are skin and soft tissue infections such as abscess or cellulitis. So first is a pocket of infection that forms in the site of injury and usually filled with pus and area surroundings and abscess is usually red, painful and swollen, and the skin surroundings abscess feel warm to the touch. So an infections of these underlying layers of the skin usually results from scrape or cut in the skin which allows bacteria to enter, although no injury may apparent. So cellulitis can occur anywhere in the body, so but most often occurs on the legs or arms. So symptoms include redness, swelling, and pain sites of infections. So the duration of illness of those um, disease for those people who do not do get an infection, the time from exposure to development of disease can be from days to years. So many common skin infections caused by um, aureus will heal without medical treatment. However, some skin infection will requires incisions of drainage of the infected site, and some infections are requires antibiotics. So that is uh, the symptoms and the effects of the those foodborne disease in and animal products. So the next foodborne disease that in animal products is trichinosis. So the signs of trinylisis of this kind of diseases is severity and durations of vary is yun sa diarrhea, vomiting, fever, and abdominal discomfort are often the first symptoms of trichinosis. So headaches, fevers, chills, cold, swelling of the face and eyes, um, itching joints, muscle pains, um, itchy skin, diarrhea, or constipations may follow from this is the first symptoms. So if the infection is heavy, the patients may experience difficulty coordinating movements and have a heart and breathing problems, and serves case that can occur. So for mild and so moderate infections, most symptoms subside within a few months, and diarrhea may last for months. So how soon after infection will symptoms appear? In trichinosis and trichinosis. So abdominal symptoms can occur 1 to 2 days after infections. So further symptoms usually start and 2 to 8 weeks after eating. So contaminated meat. So symptoms may range from very mild to serve and relate to the number of infections worms consume in meat. So often mild case of trichinosis are never specially diagnosed or assumed to be the flu of other common illness. So um, how does infections occur in human and animals? When the humans or animals eat the meat that contains infected in trichinosis, the acid and the stomach dissolves the hard covering of the cells around the larvae of and release the worms. The worms pass into the small intestine, and 1 to 2 days become mature. So after mating, adult females lay eggs. So eggs develop into immature worms, travel through the arteries, and are transported in muscle. Within the muscle, the worms core into a ball and can become enclosed in capsule. So that is the effects or and the symptoms of the foodborne illness, which is the trichinosis. So that is the symptoms of foodborne disease in the animal product. So that to prevent the foodborne disease in the food product in animals is one of the most important is the personal hygiene habits can also prevent foodborne illness. So following these simple steps ensure that are making most of your hand washing. Apply soap to your hands before you handle the animals like pig, goats, chickens, or etc. And be always sanitize your hands, so to prevent the disinfect. So and dry your hands with air dry and paper towel if possible, to turn off your with paper towel. So those strategies to prevent uh, the foodborne disease, it is very important because to assure that the the product will be uh, presentable to the market. And that's all. Thank you.